Welcome back to News 3 Today at 11. Movement disorders are neurological conditions that can be difficult to diagnose, treat, and even understand. Next month, St. Joseph's Candler is hosting a free luncheon for patients and their caregivers to help them navigate their journeys. Catherine Harn is the outreach coordinator for St. Joseph's Candler's Movement Disorders program. She joins us now with more. Thank you so much for being here today.
Thank you for having me.
Well, listen, first of all, this is a difficult topic. An easy question for me to ask you, but probably a difficult question for you to answer is, what exactly are movement disorders?
So movement disorders refer to a group of neurological conditions that affect a patient's ease or quality of movement. So typically that presents with problems with tremors or other type of movement impairment. So when people think about neurological movement disorders, usually the first thing that comes to mind is Parkinson's disease. However, essential tremors and restless leg syndrome are actually more commonly occurring in the population. So other conditions include tic and Tourette syndrome, Huntington's disease, Lewy body dementia, and ataxia.
Now, we were talking during the break, and you said that this is a loaded question, but I'm going to ask it anyway. What are some of the reasons behind these conditions?
So the reasons behind a movement disorder diagnosis are multifactorial. So for most people, it's a combination of both genetics and then environmental conditions, but we are still trying to understand all of the root causes.
Now, most of the time, oftentimes, patients with movement disorders have needs outside of the medical scope. Let's talk about that.
Well, that's basically my entire position.
Yeah, that's where you come in.
That is where I come in, and that is why we have a movement disorder program, which is the only one of its kind in the region, and I'm so privileged and proud to be a part of it.
Let's talk about that program, because you said this is the only one in the region. How important is that, and what impact does that have on patients, not only in our area, but who come to the area for treatment?
Absolutely. So we consider ourselves a lifeline for any patient with a diagnosis, whether or not they're affiliated with our hospital system. So we provide support groups, educational events, literature, and just really support and education, as well as connection to community resources, which can help patients live successfully and independently.
What are some of the questions that caregivers and patients have? What are some of the most common questions they have when they're faced with this journey?
Absolutely. Well, it's a full spectrum. And I think when most people receive this diagnosis, it can be very demoralizing. And they can start to question, what will my future look like? How will my retirement be? Will I be able to be as independent as I would like to be? And so sometimes it's more specific. It's practical things like, how can I still be involved in the community knowing that I need some help with my activities of daily life? How do I choose a home care provider? What is the best assisted living for me? What is the best physical therapy option for me? And some of those things, of course, your physician as your guiding light can answer, but some of those things fall under the more social services realm, and that's where our program can meet that need. Yeah,
and so you want all the questions at the luncheon that you're hosting coming up in November. Tell us about that, because you'll have special speakers there and a chance for the audience to ask these important questions.
Absolutely, and that's one of the things that we love about hosting these events, is that anyone, the luncheon is free. It's open to any patient or caregiver or family member who has an interest in these conditions, and they can come and ask their questions directly from the professional to receive that expert guidance. So Dr. Leslie Pittman, who's with St. Joseph Candler Primary Care, will again be our keynote speaker. And we will also welcome 2 speakers from UGA Cares, which is Cognitive Aging Research Education Center, who will come down and speak to us about caregiver resources and also about brain health at every age.
So what should participants prepare for before coming to the event?
Well, basically, they just need to come with an open mind and a willingness to ask the questions that are important to them. We are looking to meet the need that exists. So not the need that we feel exists, but meeting patients where they are and helping them to maintain their quality of life.
And I would imagine that this luncheon has been pretty successful because is this the third year you've done it?
This will be the fourth year.
The fourth year, okay.
And then we also provide a larger seminar in Savannah in April, which is a bigger version of what we're doing. In Statesboro, we are very dedicated to providing services and support to more rural areas, and we were so pleased to receive a grant from the Hospital Authority of Bullock County, which helped us to support this luncheon. We're also grateful to the Kiwanis Club of Statesboro for hosting us again.
Wonderful, and here's the information on your screen. The Movement Disorders Luncheon in Statesboro will take place Wednesday, November 12th from 9 a.m. until 1:30 p.m. at the Kiwanis Club that's located on Highway 67 to RSVP, because you do have to RSVP.
Yes, ma'am, please.
Call 912, please, 663-6803 or email Harn, that's HARNEKA @sjchs.org. You can find more information and see this interview again anytime on our website. Just visit wsav.com/community corner. Thank you so much for joining us today.
Thank you so much for having me. I appreciate your time.